Hi. Yesterday we have seen how to give the ICDs for a life scenario. Today I will explain how to give the ENM level and any workup done and modifier. Um, Firstly, we need to check the elements of HPI, PMH, physical examination, and how to give the medical decision making part. So we will go to encoder pro firstly. Okay, these are the CPTs 99281, 282, 283, 284, 285. So according to the report, whatever the elements components we are getting, we will give the ENM level. Okay, here in this we have the chief complaint. Yes, I have the chief complaint. That means we'll go to table. Yes, here is the table to calculate the ENM level. Yes, here this is the type of history to calculate. I have the chief complaint. So we have chief complaint in all the type of history. Next we will see what are the remaining elements we are getting in the report. One is in HPI we have the location, that is abdominal pain. Where is it? It is in the right lower quadrant pain, so that will be the location. And since the pain is from 2 days, that will be the duration. Then coming to burning pain, what is the burning pain? That is the quality. Okay, we had till now we got 3 elements. One is location, duration and quality. Next, location, duration, quality, and patient has taken some narco for pain control, so this will be the modifying factor. So I have got 4 elements, right? So in HPI I got 4 elements, so this will be the extended HPI. So in this table I got chief complaint and extended HPI. In HPI I got 4 elements, so 4 elements means it will be extended. As I explained previously in the table, extended it contains 4 elements, so it will be extended. Next, coming to the review of system. Yes, in this how many systems are reviewed? 1, 2, 3, 4, 5, 6, 7. 7 systems are reviewed. 7 systems reviewed means we will check here in ROS part. In ROS part we have 3 types of ROS, right? So how many systems are reviewed? 7 systems are reviewed. So what will be the ROS? Type of the ROS? It will be extended. Yes, so extended. So I got chief complaint, HPI extended, ROS extended. Next we will see PFSH. PFSH I have one element from 3 history. See, like I have hypertension in personal history, father is diabetic in family history, former smoker in the social history. That means I have each element, each chronic condition or the condition in each type of history. That means it will be a complete PFSH, I can say. See here, because I have one element from 3 history, isn't it? So that will be the complete PFSH. And as it is an emergency department, so I am taking from the new patient initial encounter total PFSH. So I got chief complaint, extended HPI, extended ROS, and PFSH as complete. As I have met 3 components in the type of history, but only PFSH as complete, so we will take the lesser one. That means I will take the pertinent PFSH, because complete means it covers pertinent also, right? Now here I have met the 3 components and only 1 component in comprehensive, so weightage is more to the detailed type, isn't it? 3 things are met and only 1 thing is met, so we will take the lesser one. So in pertinent we have at least 1 element. Yes, we have that. So our type of history is detailed history. So where it is We will see detail history. Yes, here it is. In 99284 I have detail history. Next we will see physical examination of the chart. Yes, physical examination. What all the systems are reviewed by the physician? 1, 2, 3, 4, 5, 6, 7. So 7 systems are reviewed by the ED physician. So 7 systems are there. 1, 2, 3. We can check here also. 7 systems are there. So 7 means for problem focus we need 1 to 5. For EPF and detail we need 6 elements. For comprehensive we need at least 9. So 7 means either we can take EPF or detail. So because in this 6 systems are enough, but we have 7, so we can take any one, either EPF or detail. So I am taking detail. Why? Because I have got the detail HPI. So our physical examination will be detailed physical examination. So far I have got detailed HPI, detailed physical examination. Now we will go to medical decision making part. So as patient is having right lower quadrant pain, physician has done CT, radiology, urine analysis, and he gives the drug also for pain control, injection morphine. So it will be the, see here it is administered with morphine injection. So it is nothing but the, we can check in this table, medical decision making table. As I told in the previous session, no need to worry, we can check in the medical decision making table also. So yes, where is that prescription drug management? Yes, here it is, prescription drug management. So our level of risk for the moderate medical decision making is moderate. So moderate means in the table it will be moderate complexity type of medical decision making. So I got detailed history, detailed examination, and medical decision making of moderate, isn't it? I got all the elements in detailed history, detailed examination, and MDM as moderate, because patient is prescribed, he is administering the drug, right? So he is giving the medication, so that will be the moderate medical decision making. So our ENM level is 99284. Now I will quote the ICDs, sorry, CPTs 99284. Along with that we will give a workup done CPTs also. As patient is giving, physician is giving intramuscular injection, IM injection. So the code is, I have explained this also in the previous thing. So our code is 96372. Yes, physician is giving intramuscular injection morphine for pain control, diagnostic injection. So I will add this code also, this CPT also, along with the ENM level. Okay, 96372 is another CPT. So one more thing, as patient is as physician is ordering the workup and he is giving the injection, so for that we need to give a modifier. In order that physician is doing a separate ENM service, so that is 25 modifier I am adding to the ENM service. These modifiers are also very important. So overall I have given the ENM service CPT, that is 99284 according to the ENM table which I have explained here. Next, coming to the modifier, workup done to the patient, and workup done CPT 96372. This completes the CPT's modifier and workup done CPT, and in the previous session I explained the ICDs also. This completes the whole chart. Thank you for watching the video. If you have any queries, please comment below.